From the time we are young, we are taught to say, "I'm sorry." Whether we have hurt someone's feelings or their being, we are taught that apologizing and accepting apologies with grace is the right thing to do. We accept responsibility and we move on with what we have learned and with what we have forgiven. I wish I had that chance. About 12 years ago, I met you for the first time. I'd been a nurse for 8 years. I loved the critical thinking, the helping, the patient care, and the teamwork. During this time, I worked in the emergency department. I worked part-time and was eager to pick up extra shifts, especially on weekends. We still do not know who found you, barely alive and sleeping amongst some trees. They knew you were sick, blood coming from your mouth, nobody else around. They knew you needed help, and they called for an ambulance. When the paramedics arrived, they moved quickly. Your blood pressure was low, your pulse was fast. They thought you might have a GI bleed. They supported your airway, put you on a monitor, started to give you some intravenous fluids. They phoned the ER. I was in charge. I asked my team to prepare the resuscitation room, and we alerted the doctor. On the way to the hospital, you started to vomit. You were only minutes away, and everyone was ready to help you. It was such a busy day. At that time, we didn't have a formal triage process. So much going on all over the department, and we were short one nurse and had only one physician on call. A diagnosis of GI bleed was made by the on-call physician. The intensivist and on-call surgeon were called. Orders were given, both verbally and in writing. You needed to be admitted to the ICU. You needed some surgical intervention to help, but first, you needed some medication. I was asked to process the medication order and get the medication stat. I hadn't heard of this drug before. I couldn't quite make out the drug name, so I asked for confirmation. The physician clarified. We didn't have the drug on hand, so I had to call the pharmacy quickly. When I spoke with the pharmacist and explained what I needed, the pharmacist told me that the drug was not on our formulary yet. It was new and could only be ordered by the internists. I explained that the surgeon had ordered the drug and the patient was unstable. Could he please send the drug right away and we would talk process later? Felt like a lot of time had passed, and I explained that the drug was on the way. The box on the right was sent in the Telelift. Didn't look exactly like the order, didn't seem like the right stuff. I needed to check. I could hear them in the resuscitation room wondering where the drug was. Quickly, I searched for information about this drug that I had never given before. I searched in many different places, including our hospital-specific IV medication manual. I couldn't find anything that clearly provided information to make a good decision. I needed to ask someone. Was it possible the department was getting busier? I checked with my teammates. They weren't sure either. One nurse said she thought the drug looked correct, and she suggested I show the physician and ask if it was the right stuff. I showed the doctor the box. The doctor said, "Yes, that's it. Give it all. IV push right now." You were so sick, and I moved quickly. The syringe was nearly empty when you started vomiting and crying out in pain. What was going on? More orders were given, more action taken. A coworker told me that I was needed on the phone. I answered the phone and heard, "Do not give that medication. I sent the wrong drug." I said that not only had I already given it, but I had given the entire 5 ml vial. How could I have done that? We talk now of the system in which we work and how sometimes the safeguards do not work or they haven't been developed. Now we use science and experience, and together we do better. But what I know is how I felt. I had done that to you. I had given you the drug. I had made you worse. I needed to let the doctor know. You were being stabilized and prepared for medevac to a tertiary care center. I told the intensivist what I had done. He said, "Well, you probably killed him." That was it. Nothing else. What happens now? I filled out an incident report and I finished my shift. In the days that followed, I wondered how you were. To say I felt guilt and shame was an understatement. My manager asked if I had learned anything, and I was told, "Well, you won't make that mistake again." I spoke with another intensivist who knew about this case, and together we learned about overdosing with this drug. After a short stay in the tertiary hospital, you were transferred back to our intensive care unit. I learned that you had died 2 weeks after I gave you the wrong drug. You died of multi-organ failure. People said it wasn't my fault. You had many health problems. You likely would have died anyway. But I wonder, what if I didn't work that day? I want to say I'm sorry. I didn't want to make you worse. I feel very responsible for making you sicker. I feel responsible for 2 weeks of suffering and your death. Just an incident report and a mountain of guilt. I want to say I'm sorry. I wish things were different, but they weren't. I wish we could have understood all of the facts, all of the processes and intricacies which may have contributed to this. Maybe then I wouldn't feel such guilt. Maybe then I could have said, I'm sorry. I promise that this experience has made me better, to earn the trust of patients who are vulnerable and their families who are afraid. It has pushed me to commit my career to work with patients, families, and providers to make care safer. I promise to be informed, apply best practice, stop the line, and to trust my gut. The purpose of this slide is to give the message that now in that same facility, that same department, there's a better approach, open conversations, reporting of patient safety incidents. Staff are asked to share information and identify solutions to problems. Learning from mistakes is facilitated. The learning is shared with others. Healthcare providers are asking, listening, and talking. Let's dedicate ourselves here today to hold the hands of our colleagues, our patients, and our families with the tenacity to create a very strong net of solid, safe processes, where everyone, from those who are closest to the patient to those who are furthest away, know that together we will make care safer. I promise, and I am sorry.